There's a fascinating study published in the journal Stroke back in 2014 that almost no patient has ever heard of. Yet it is arguably one of the most useful pieces of cardiovascular research for adults over 60 in the last 20 years. The researchers followed nearly 1,400 patients with an average age of 67. They gave them a single, incredibly simple physical test that took less than a minute, and then they MRI imaged their brains. The results were absolutely startling. The patients who failed the simple physical test had significantly more evidence of cerebral small vessel disease, the silent, invisible precursor to a massive stroke, than the patients who passed it. The test was shockingly simple. Stand on one leg with your eyes open for exactly 20 seconds. That's it. Patients who could not hold that pose had, on average, more silent strokes already occurring in their brains, significantly more white matter lesions, and a mathematically higher risk of future catastrophic cardiovascular events than the patients who could stand steady. I am Dr. Marcus Okoro. On this channel, we strip away the medical jargon and walk directly through the published research on the decisions that matter most after the age of 65. Today, we are going to break down the simplest 30-second test you can do tomorrow morning in your own bathroom that gives you a profound, immediate read on your brain's vascular health. We will explore exactly why it works, what you must do if you fail it, and the 4 highly specific modifiable factors that will improve your score and save your brain. To understand why standing on one leg correlates so powerfully with your stroke risk, you need a crucial piece of neurology that is almost never properly communicated during a rushed primary care visit. Your physical ability to balance on one leg requires the rapid, flawless integration of 3 entirely separate neurological input streams: your visual system, your vestibular system inside your inner ear, and your proprioception, which is your brain's sense of exactly where your body is in space. The integration of these 3 complex systems happens in highly specific areas of your brain that are uniquely sensitive to small vessel disease, the gradual, microscopic narrowing of the tiny arteries that feed your brain tissue. When those microscopic vessels begin to choke and fail, often years before you ever feel a single noticeable symptom, the integration of these 3 streams becomes slower. It becomes less reliable. It becomes imprecise. Balancing on one leg is essentially a physical stress test for that neurological integration. A healthy 50-year-old can hold that pose for 30 seconds effortlessly. But a patient with silently developing cerebral small vessel disease, even if they feel completely fine and have 0 symptoms, typically begins to wildly struggle past the 15 or 20-second mark. The Tabara study strictly quantified this biological threshold. The inability to balance on one leg for 20 seconds with eyes open was associated with a roughly 3-fold increased risk of having multiple silent infarcts, microscopic strokes, on a brain MRI, even after controlling for age and blood pressure. That is not a marginal effect. That is a blaring red alert signal that the vascular system inside the brain is under massive stress. Let me introduce you to a patient named Helen. Helen was 70, a retired librarian. She took a daily baby aspirin, walked every single day, and her blood pressure was flawlessly controlled at 125/78 on a single low-dose ACE inhibitor. By every conventional medical measure, she was doing spectacularly well. During her physical, I asked her to try the one-leg test right there in my office. She made it about 11 seconds before she started wavering and had to put her foot down. She tried again, 8 seconds. She was genuinely shocked. She had always considered herself a very well-balanced person. Based entirely on that single failed physical test, I ordered a brain MRI. The imaging came back showing multiple subtle small vessel ischemic changes in her white matter, completely consistent with chronic hypertensive small vessel disease, even though her blood pressure on paper was technically controlled. The physical damage was already actively occurring inside her brain. It just hadn't progressed far enough to produce clinical symptoms yet. We immediately adjusted her treatment protocol. We titrated her ACE inhibitor up slightly to tighten her blood pressure control even further. We added a tiny dose of a targeted statin, and she began a structured balance training program twice a week. 6 months later, she stood in my office and held a flawless one-leg balance for 28 seconds. A repeat MRI exactly a year later showed 0 progression of the existing white matter changes. That 30-second test in the office is what triggered that entire life-saving intervention. Without it, she would have happily continued under the dangerous assumption that her well-controlled numbers were good enough. The simple balance test revealed that her brain's microscopic vessels desperately needed aggressive protection. Before I walk you through the exact protocol to execute this test at home, I must warn you about the most common mistakes I see patients make. When trying this in the bathroom, do not stand on a slippery wet floor. Do not hold on to the towel rack for support, and absolutely do not close your eyes. Each of those variables completely ruins the diagnostic value of the test. The protocol is strict: bare feet or non-slip socks on a highly stable surface, eyes wide open with absolutely zero physical support. You should stand near a wall or a counter so you have something to grab if you start to fall, but you must not touch it during the actual test. Have you ever tried this test before? Or has any doctor ever actually asked you to perform it? Drop a comment below with exactly how long you can hold it. I am genuinely interested in seeing what people's baselines look like in the real world, because the data on this in normal home environments is surprisingly sparse compared to rigid clinical trials. Here is the full 30-second morning bathroom protocol. It consists of 3 rapid consecutive tests. Together, they provide you with a highly comprehensive real-time read on your brain's vascular function. Test 1, the one-leg balance. Stand barefoot or in non-slip socks on a hard, stable bathroom floor, close to, but not touching, a wall or the sink counter. Lift one foot completely off the ground, bringing it about 6 inches up. Keep your eyes wide open. Lock your vision onto a fixed point straight ahead of you. Do not look down at your feet. Time yourself with a smartphone stopwatch or simply count 1 Mississippi steadily in your head. A passing safe score in adults 60 and over is 20 solid seconds. An excellent score is 30 seconds. If you cannot reach the 15-second mark without aggressively staggering, wavering, or putting your foot down, that is a highly meaningful biological signal that is absolutely worth a serious conversation with your physician. You must switch legs and test both sides. A massive asymmetry between the 2 legs, for example, holding one for 30 seconds and the other for only 5, can indicate a highly localized focal neurological issue rather than general vascular decline. Test 2, the mirror smile test. Stand perfectly still and look directly at yourself in the bathroom mirror. Smile as broadly as you possibly can, showing your teeth, and hold that exaggerated smile for 3 full seconds. Look incredibly closely at the symmetry of your face. Both corners of your mouth should rise equally and sharply. If one side droops, lags, or rises noticeably less than the other, even subtly, that is a potential indicator of facial nerve weakness, which is a classic early warning sign of cerebrovascular compromise. This is essentially the F in the famous FAST stroke screening acronym, applied proactively as a daily diagnostic check rather than an emergency response. Test 3, the hand grip test, 10 seconds. Grab your toothbrush, a heavy water glass, or any solid, small object firmly with your right hand for 10 seconds, squeezing hard. Then do the exact same thing with your left hand. Mentally compare the raw physical strength between the 2 hands. They should feel incredibly equal and balanced. A sudden, noticeable weakness or clumsiness on one side compared to the other is a blaring potential indicator of subtle motor cortex changes in the brain. This is the A in the FAST acronym, arm strength asymmetry. Together, these 3 physical tests take less than 30 seconds combined. If you execute them daily, they provide you with a continuous, real-time neurological monitoring system that catches microscopic changes vastly earlier than a rushed, 15-minute annual physical ever could. Now, we must discuss exactly what you should do if you fail one of these tests. I want to be incredibly specific here, because vague medical guidance leads to either dangerous complacency or unnecessary panic, neither of which will save your life. First, if you simply have an isolated single bad day, you couldn't balance because you are exhausted, fighting a head cold, or dealing with a minor inner ear infection, do not panic. Simply repeat the test the following morning. An inability to balance stemming from a temporary virus does not equal permanent cerebral small vessel disease. Second, if you consistently fail the one-leg balance test, falling well under 15 seconds across multiple consecutive days, you must schedule a deliberate conversation with your primary care physician. Ask them specifically about cerebral small vessel disease screening. Your doctor may order a specialized brain MRI or refer you directly to a neurologist. This is not a drop-everything emergency, but it is highly meaningful, actionable clinical information. Third, and most importantly, if you notice a sudden, brand-new asymmetry, if one side of your smile droops today when it was perfectly fine yesterday, or if you experience sudden, profound weakness in one hand, this is potentially an active stroke or a transient ischemic attack, a TIA. You must call emergency services immediately. When it comes to stroke care, time to treatment dictates whether you walk out of the hospital or leave in a wheelchair. I must reiterate, this 30-second protocol is a brilliant screening tool, but it is not a diagnostic tool. It simply alerts you that something inside your brain's plumbing is worth investigating. It does not tell you exactly what is wrong. If you struggled with the balance test, here are the 4 highly specific, modifiable factors that most strongly improve your neurological results over time, ranked in order of absolute impact for the average patient over 65. Factor 1. Uncompromising blood pressure control. I do not just mean controlled, I mean tightly, flawlessly controlled. Modern neurological guidelines strongly suggest a rigid target of under 130/80 for adults at an elevated cardiovascular risk. Cerebral small vessel disease is, at its absolute biological core, a hypertensive disease tearing apart the microscopic vessels. You must protect those vessels from high pressure. Factor 2. Daily, purposeful walking. A massive 2018 meta-analysis proved that engaging in just 30 minutes of brisk daily walking actively reduced incident cerebrovascular events by approximately 20% in adults over the age of 60. This profound effect is mediated partly through systemic blood pressure improvement and partly through direct healing benefits to the delicate vascular endothelium. Factor 3. Restorative sleep architecture. Chronically sleeping for less than 6 hours a night is heavily associated with the rapid progression of small vessel disease, completely independent of your blood pressure. Why? Because deep sleep is the exclusive biological window when your brain's glymphatic system physically flushes toxic metabolic waste out of your brain tissue. Inadequate sleep means that toxic waste simply accumulates, violently compounding the injury to your small vessels over the years. Factor 4. Specific targeted balance training. Executing just 2 10-minute sessions per week of highly structured balance work, such as single leg holds, tandem tightrope walking, and dynamic stability exercises, measurably and rapidly improves your one-leg balance time within just 4 to 6 weeks. This rapid improvement reflects a legitimate recovery of your brain's neural integration pathways, not just an increase in leg muscle strength. Helen sent me a video on her phone last month. She is standing perfectly still on one leg in her kitchen, casually brushing her teeth with her other hand, utilizing absolutely zero support, and she holds the flawless position for nearly a full minute. She is 71 years old now. Her morning blood pressure is locked in at 119/76. Her last comprehensive cognitive screen was immaculate, and she is still aggressively walking 3 miles a day. She wrote a note attached to the video that said, "Dr. Okoro, I would have spent the next entire decade blindly thinking I was doing perfectly well if you hadn't simply asked me to stand on one leg in your office. It is the funniest thing. That ridiculous, simple little test changed the entire trajectory of my life." That is exactly what this video is about. The 30-second test you execute in your bathroom tomorrow morning is arguably one of the most useful, profound self-screens you can ever run. It costs absolutely nothing. It requires zero medical equipment, and it might reveal a silent, terrifying reality that your rushed annual physical is completely missing. If you have never tried it, I want you to try it tomorrow morning. Tell me in the comments exactly what score you got. 20 seconds is the vital threshold. If you cleared it easily, you now possess a highly useful baseline to track going forward. If you heavily struggled, that is critical, life-saving information that is absolutely worth bringing to your physician. Take care of your brain, take care of your balance, and I will see you in the next video.